ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆಯ ಮಾನ್ಯತೆ ಪಡೆದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯವಾಗಿರಲಿ. ವಂದನೆಗಳು. ಓವರ್ ಟು ಡಾಕ್ಟರ್ ಮಹೇಶ್.
Yes, sir. Mahesh, sir.
And
Mahesh, speaker
sir.
introduce ಮಾಡಪ್ಪ.
Sir. Dr. H.S. Lalita, consultant at Sri Women's Care and Fertility Center, Tumkur. She is practicing obstetrics and gynecology since 1999. Special interest in PCODs and cancer screening. And she is also certified with additional in adolescents, infertility and colposcopy and nutrition, and member of PCPNDT District Advisor Committee, KPME, Tumkur Committee Advisory, Tumkur, and member Breast and Purpural Committee, Foxy, and presented many papers in state and national conferences. Master trainer in IUCD, PPIUCD, and adolescent reproductive and sexual health, and SBA training, Government of India. Conducted around 200 health camps, including adolescent and breast cancer screening. And she is also running a trust in the name of Sevanthi Cancer Prevention, Care and Cure Trust and Sri Charitable Welfare Trust. She is now today speaking on the topic importance of gut health in our practice. Over to you, Madam Dr. Lalita HS from Tumkur.
Thank you very much. Illargu namaskara. I thank IMA to give me this opportunity, share a piece of my mind. And a special thanks to Dr. Mahesh for introducing me so nicely, and also to encourage me to talk today. Yeah. Next slide, please. In 400th century, Hippocrates had said all disease begins in the gut. We never understood the importance of it till now. Yeah, please stay on. No, not next slide. Now it has become more and more relevant today than ever before. So let's see some studies with the modern technology, investigations, and all the research in the modern medicine. Let's review a few papers related to this. Next slide, please. Gut microbiota, the important player in type 2 diabetes mellitus, says that the findings suggest that we can treat type 2 diabetes mellitus and its complications by remodeling the gut microbiota through interventions such as drugs, probiotics, prebiotics, fecal microbiota transplantation, and diets. The study was done by Zheng Zhou et al. Next slide, please. Gut microbiota and PCOS, understanding the pathogenesis and the role of probiotics as therapeutic strategy, done by Samena Salehi et al. This says that short-chain fatty acids produced by intestinal microbiota through fermentation plays an essential role in regulating metabolic activities that are helpful in reducing insulin resistance and improving PCOS systems. They also have shown that the short-chain fatty acids that is produced, the serum levels of these short-chain fatty acids, has a very big impact on reducing PCOS in many women. They also say the effectiveness of using probiotic supplementation has been proven to improve the condition of women with PCOS. Daily consumption of probiotics improves dysbiosis of the intestinal microbiome and increase the production of short-chain fatty acids. Next slide, please. Another study done by Ankita Verma on gut-brain axis, role of microbiome, metabolomics, hormones, and stress in mental health disorders clearly says that probiotics have a very big improvement in mental health symptoms, and the disorders, especially anxiety and depressive disorders, whose prevalence has increased by over 50% in past 3 decades. Next slide, please. So all these says it is proved beyond doubt that the gut health is very, very important in almost all the diseases that we see in our OPDs, especially today. There are trillions and trillions of gut microbiota in our body. The maximum, that is 95% of body's microbiota, is found in the gut, from oral cavity to the anus. It is also found in nasal cavity, vagina, skin, and gut. So the gut microbiota, so when we say, I cannot any longer say I, because I'm along with trillions of bacterium, I'm existing on this earth. So I think hereafter we should start saying it is we. Next slide, please. So the abundant bacteria in our body, which help in very crucial, it plays a crucial role by producing many chemicals and hormones, and even including vitamins, which are very, very crucial to function, normal function of the body, and also prevent many diseases. Next slide, please. So there is what is called as gut balance between good bacteria and bad bacteria, to say. And 70% of these bacteria is opportunistic bacteria, and their role determines whether which side is the opportunistic bacteria. 85% of good bacteria and 15% of bad bacteria is very important, very crucial to maintain a very good gut health. Even if there is a 5% reduction, the opportunistic bacteria takes over to the wrong side, then there is an imbalance, and we call it as dysbiosis. Next slide. Next slide, please. This is how our gut microbiota looks like in our intestine. It is just like a good mended garden with lot of different flowers, fruits, vegetables. So the not just the colonies of bacteria, the amount of bacteria, that is the number of bacteria that is important, but also the variety of species are also important. Each has its own specific function in our body, and each can produce a specific chemical. Next slide, please. So these are some of the examples of the probiotics. Next slide, please. So if there is a imbalance, it is called as gut dysbiosis, which is today the root cause of many lifestyle diseases. So it is very, very important to maintain the balance. So this is the well-maintained gut, and if it is lost, if there is an imbalance, the gut permeability increases. There is a gap between the cells, and the undigested food particles enter the bloodstream through these gut leak, and they evoke an inflammatory response and triggers lot of chemicals like cytokinins. So it is very, very important that the gut leak is prevented. Next slide, please. Gut. These bacteria produce a lot of chemicals and intervene in many reactions in our body. Like short chain fatty acids are produced, which is known to prevent insulin sensitization. So a normal healthy gut reduces the glycemia, reduces insulin resistance, reduced inflammation. Hepatic steatosis is reduced. That is the fatty liver, and with different grades, there is reduced food intake and reduced plasma lipids. If there is leaky gut, impaired gut barrier, then all these are raised. There is an inflammation that is raised. Steatosis is increased, oxidative stress is increased, insulin resistance also, insulin sensitivity is also raised, and there is food intake increase. So the obesity, it is impaired gut barrier is one of the root cause of obesity in today's many patients we see with a lot of obesity. This is the root cause. Next slide, please. So what are the diseases that are associated with this dysbiosis? Atherosclerosis is the main thing, and irritable bowel syndrome, wound healing, many types of cancers, and antiviral, antifungal, antibacterial immunity. The gut microbiome plays a significant role in various global health conditions. Next slide, please. So this is the balance. If the pathogens take upper hand, then there is dysbiosis. If there is a symbionts or the good bacteria take an upper hand, then there is no dysbiosis. Gut health is restored. So what causes this dysbiosis? The interaction between different bacterial species, the antibiotics, the repeated use of antibiotics, and after the usage of antibiotics, if the gut health is not restored properly, that dysbiosis continues and increases. Genetic features also play an important role. Diet plays a very important role. Psychological stress and physical stress also. Lack of exercise also plays an important role. Radiation, chemotherapy, exposure to a lot of radiations are all play a key role in causing dysbiosis. Next slide, please. It also produces a lot of chemicals in the gut. 70% of serotonin is made in the gut. What's going on in the gut is going to affect mood, anxiety, depression, and focus. So that these gut hormones have a specific role. The melatonin that is produced, which plays a key vital role in sleep and wake cycle. So this is increased if take a warm bath or exercise regularly, and artificial light is reduced, and also the fresh fruits they all increase the production of melatonin from the gut bacteria. Emerging studies demonstrate the gut microbes' influence on mood through the gut-brain axis, mirroring culinary practices worldwide. Why a specific cultured people behave in a particular way may have a root on these culinary practices and the chemicals that is produced in the gut. The role of microbiota in infections and inflammation is it plays a key and vital role. Resilient gut microbe boost the immune system, helping prevent infections and autoimmune conditions, aligning with health practices in various cultures. For example, each actinobacteria improves the intestinal barrier function, prevents gut leak, seals the gut leak wherever there is, and also inhibits inflammation by not triggering the cytokinins. So each bacteria is very specific in action and very specific in what they produce, but we would require all of them. Next slide, please. Aging also has, next slide, please. Next slide, please. Next. Aging and gut microbe is very, very resilient. It is different bacteria at different age that plays a vital role. As individuals age, their gut microbe also evolves, impacting digestion and nutrient absorption, what is required for that particular age. Dietary practices supporting gut health are very, very crucial in later years. So this is supposed to be the cause of lowering of immunity in aged people or after 50, where the cancers crop up due to the lack of immunity. So gut health is the secret to longevity. If you feed your tiny microbes well, warriors well, they will help you to thrive. Says a practitioner on gut health. Next slide, please. So there are different bacteria that we require at different age, and each has specific function. Especially, it is very closely related to the immunity of our body. Among older women who received probiotics, bone loss was halved compared to the women who received placebo. Even the bone regeneration and bone resilience is maintained at joints. Also, gut microbes play a very important role. The gut microbe is absolutely critical to healthy aging. There is Dr. Will Pulsevic, a US medical director who practices lifestyle medicine. Next slide, please. So it is possible to spoil the gut. It is also possible to reset what is spoiled. This dysbiosis is reversible. And of course, the time taken to reverse and the effort taken to reverse this dysbiosis depends on what is the damage that is already been done, the disease process, and the complication that particular disease involves. So, but it is very, very vital in everybody's health, which can be done all along with the treatment as well. Next slide, please. Let's see how we can set the gut right, where the dysbiosis is reversed to a healthy gut. This is an emerging branch of medicine, which is called lifestyle medicine. But since Hippocrates, we have been seeing all through, there have been warnings to maintain the gut. Gut health is a key to overall health. By Chris Carr, almost all our health concerns can be traced back to our bellies. Ensure a healthy gut, the rest will take care of itself. Our food should be our medicine, and our medicine should be our food. Walking is the man's best medicine. Next slide, please. So, as advised by lifestyle medicine, so there are 6 pillars of lifestyle. Exercise regularly, not once in a week or twice a week and so on, or whenever we feel like. Important is to exercise regularly. Stress management, the nutrition. Nutrition, what foods to avoid is equally important. What food to take, both in quantity and quality. What food to avoid definitely has a key role. The processed food, whatever comes from the factory, has lot of preservatives, chemicals dumped to it. Even the coloring agents, the flavoring agents, all are chemicals which are harmful to the body. Not just that, they destroy the gut bacteria. And sweeteners, sugars, any form of sugar, any kind of sugar, even the artificial sweeteners are all chemicals, and they destroy the gut bacteria. Refined carbohydrates like maida and polished rice, high fat foods, especially the saturated fat, and even more specifically, saturated fat from animal sources. Alcohol, caffeine, spicy food, which has lot of artificial spice from taste enhancers, which are all chemicals, and they destroy instantly the good bacteria which is supporting us. And they are all termed, of course, as junk foods, which are not necessary to maintain the nutrition of our body. The other pillars are sleep and also social support, helping each other, supporting each other, encouraging each other to live a healthy lifestyle is also one of the pillars in what lifestyle medicine describes. Next slide, please. I practice gut reset since past 4 years. What I do is I take a detailed lifestyle history, body parameters like BMI, BMR, visceral fat, etc. So the lifestyle history includes all these 6 areas. How is their sleep rhythm? How regular is the sleep? How regular is the food habit, what they eat according to their culture? And how regular is a food habit? How much water they drink? How much exercise? And their socializing, their emotional and spiritual health. So all these detailed history and the alcohol and smoking and social media, all these things. And existing disease and the stage of disease or condition they have, investigations like vitamin B12, which gives an important parameter on, because vitamin B12, vitamin K are all produced by gut bacteria also. So the deficiency definitely indicate that there is dysbiosis and not well-maintained gut health. And also inflammatory indicators like CRP and so on. After that, analyzing all this, there'll be a very specific customized to age, culture, available time to cook. All this, considering all this, there'll be an appropriate diet chart that is prepared, and they'll be counseled, hand-holding guidance is given, and follow-up also is done. So I feel everybody should include the 7-hour practice, because almost 80% of anybody's practice, from general practice to gynec practice, where PCOS is 25 to 50% of our practice today, physicians practice, even dermatology, the skin allergies, immunity, and even the rate of cancer is growing up every day. So all this, considering all this is practicing gut health and helping patients to restore their gut health, educate them in this is very, very important. And also the prescription of probiotics and prebiotics are very, very important, and also advice on them. Probiotics are live microbes. They are like seeds of good plants. If there is the garden is spoiled, thank you for changing the slide. If the garden is spoiled, it will have a lot of unwanted animals, unwanted plants to grow in. The garden has to be overall to be destructed, and the soil should be plowed and mained rich with the manure, organic manure, and then we put good seeds and also nurture them, water them, and also fertilizers, good fertilizers are then given. Then garden looks very good and is very healthy, and we can breathe a good air, eat good vegetables, and so on. The same way, gut has to be mended like a garden inside our body. So it's very important that we give probiotics to mend this garden. They are the seeds, they are the live bacteria, which are of good strains. And also, the food for these probiotics are prebiotics, which they are not parasites. They are not like ankylostomiasis, which draws blood from us. But these gut bacteria do not um, use any of our food. They live on, they feed on the undigested fiber in our undigested food. So they are not parasites. We are not feeding them. They are doing a lot of work for free, and we should let them do that good work. Thank you so much to speak on this prestigious IMA KSP stage. Thank you very much for patient hearing. Let us all first treat ourselves, be ambassadors of good health, examples of good health to society, rather than just advisors of health. Thank you very much.
Thank you very much, madam, for your wonderful presentation on the gut health.
Thank you.
And regarding probiotics and prebiotics, and the existing and pre-existing diseases like obesity, diabetes, and other things. And thank you very much, madam. And I
Thank you.
request any members asking any questions regarding gut
The
microbiome.
dosage of probiotic, yeah, they have answered. Sir, it depends. Depends on what brand you are using and what exactly is your target treatment. There are many companies, almost all companies have come with the probiotics. Thank you very much, sir, for your encouragement.
Thank you,
Thank you,
madam.
sir.
Very good presentation.
Madam, regarding organic, they tell now. So regarding organic, what is your opinion?
Sir, organic is good. When they certify an organic farm, they go 1.6 kilometers deep inside the earth, and they take out the soil and they test it. Only then they certify as organic farm. But they display all the certificates. Suppose we buy tomato, which they say organic, they display the tomato, the brand and the certification and all that. Still we have our own roads. So what I suggest is we all should have our own garden. At least minimal vegetables, even in a balcony with 10 pots, we can grow our own vegetables to some extent, if not everything. And that's what is. And we generate a lot of waste, which can be turned into a compost. And we better grow our own vegetables, if not everything, like mensinkai, kotamri soppu, all these things we definitely can grow. So that much of pesticides we can avoid getting into our gut and causing a lot of menace.
And many of the patients, they will be telling we are having gastric and taking H1 receptors like ranitidine, omeprazole, like that. They will be in chronic. And many of them will end up in anemia and
All
other
vitamin
problems.
deficiencies, obesity. Yes, sir. This is the menace which we see very commonly in our practice. Yeah, they have to do gut health, a program, which I do it for usually 2 months. This is a total program on what they should eat, at what time they should eat, and what not to eat, along with probiotics and prebiotics and all the this. So the after this 2 months of programming, the absorption of the vital vitamins and minerals, they improve slowly. So we can see the anemia correction is done automatically, the vitamins correction are done automatically, all these things we can say. So I do a program. So that's what I practice.
Okay, madam.
Dr. Lalitha, madam, very good presentation actually.
Thank you, sir.
Eye-opener. Most of our doctors are not following proper diet, I
Yes,
feel.
sir. Yes,
One
sir.
question, madam.
Yes, sir.
See, number one, most of the doctors, we in our practice, we write patients antacids. Okay.
Yes, sir. Yes, sir.
Because I feel like it is a somatic manifestation of depression. Means
Yes, sir.
many people tell that I have abdominal pain, gastritis. I was listening to one of the psychiatrists last class. He was telling it is the manifestation of the depression. So, what is the effect of long-term antacids on overall health, madam? Gut immunity.
Sir, I have not gone through these literature.
Okay.
Long term, this, as you rightly pointed out, the gut brain axis is deranged. There
Yes,
is
madam.
already ill health of the gut. So, the lot of chemicals are produced in our gut. So, gut is called the second brain by Hippocrates. He
Okay.
has rightly said it because lot of mood elevators like serotonin, melatonin, dopamine are all produced in the gut. So we cannot just rely upon the brain to produce all these mood elevators. So food is directly linked to these mood elevators. So food is the key, how we um, use these mood elevators to help us.
Thank you, madam. Second
So
question is regarding the fasting, madam.
yes,
Intermittent fasting, 12 hours fasting. What is your opinion, madam? How it will
sir, it has
cause
nothing to do with the gut health. It doesn't improve the gut bacteria.
okay.
Fasting has no effect on this.
Oh,
So there, I have not come across any studies which support an improved gut health with the fasting alone. So maybe fasting along with taking only a good food like fruits, vegetables, and regularly. So nowadays it's a plating which says that 50% of the plate should be fruits and vegetables, preferably from an organic source, and preferably from all colors, from 7 colors, like yellow to the magenta color, yellow color, like which is papaya, carrot, which is rich in flavonoids and vitamin B, and the blue colored fruits and vegetables, and white colored vegetables, the green, the blue, and the magenta, like beetroot, all this sweet potato and so on. So they all have very trace elements. And apart from that, there are so many unidentified phytofactors, which are called as vitamins and minerals, yet to be discovered. They also play a key role in minute functions. We might not have defined it yet, but our body needs it. So this is very, very important. So 50% of our plate should be fruits and vegetables of all colors and all seasonal, locally grown. We don't have to eat blue. If I say we don't have to eat blueberry, we don't have to eat dragon fruit. It's not required. What is locally available, all the greens that is grown here, all the fruits, seasonal fruits, like bore hannu, which is available now, even that might have something, some phytofactors which our body may need. So, and another 25% of complex carbohydrates, like siridhanya, wheat, ragi, and all varieties of food, and another 25% of pulses and grains, the sprouts and the grains and all these things. So this is the more variety on our plate, the more nutrients we get. And we still don't know everything about nutrition. We should assume that we know nothing, and we should have the variety of fruits and vegetables is what is advised in the lifestyle medicine.
What is the means still this magnesium, madam? That is one mineral which is missed by many people. What is your opinion, madam? Magnesium.
Yeah,
regarding-
it is rarely available.
Yes.
I don't know the sources, but yeah, it is not commonly taken into consideration. Magnesium and selenium.
Thanks.
Hello, madam.
Magnesium.
Dr. Rajini here.
Hello,
Nice
madam.
presentation. Nice presentation, madam. Thank you.
Thank you.
We were talking about this 2 months of course. Is it online, madam?
No, it is my personal intellectual property,
Okay.
where I have gone through a lot of nutritional medicine and which I practice. So I take all the history and I give a customized diet chart to the patient, taking into consideration what their food habits and how much time they have to cook, what is their schedule and all these things. I also do, then later on I consult online or offline. So I'm follow up the patient. This is what I do. And lot of benefit is there. And recently, last month, one patient who's totally, she is a village areca nut grower. She doesn't eat anything. Even then, she has become obese, and she said, "I'm not well." And she was on gut health. She reduced 10 kgs in 2 months, and her skin is glowing. So skin is something that we see outside. It's an organ that is seen outside, and that shows that her organ health, all overall health of the body is improved just by the 2 months of program. So this is a testimonial. Like I have many patients which I see a lot of benefits, especially PCOS. PCOS, the insulin resistance comes down. We start seeing the regularity of the cycle. We start seeing the ovulation, and even their mood elevation is the first thing I notice. They come with a smiling face. That's the first thing I notice. And it does a lot of benefit to the PCOS patients, especially. That is how I started because my special interest is PCOS.
Okay, madam. Thank you. Thank you.
Thank you very much.
Thank you very much, madam.
Thank you, sir.
for your presentation and
Thank
a
you, sir.
lot of knowledge regarding gut health also we came
Yes, sir.
across. Thank you very much, madam.
Yes, sir. And those who are interested in knowing more about gut health, right now, Rajni madam asked a question. Madam, you can get in touch with me personally. We can.
Yeah. Yes, madam. Thank you. Thank you for that. I will
Yeah.
contact you. Thank you.
Thank you very much.
So
Good
I
night,
request
everybody.
everyone,
Thank you.
so I request everyone to stay online because Dr. Anuradha Parmesh will be giving the details about the schemes of the IMA, KPPS, KSHS, and KSS. So I invite Dr. Anuradha Parmesh online. Welcome, madam. Dr. Anuradha Parmesh.
Hello.
Welcome, madam.
Yes. Good evening. Good evening, everyone.
Good evening, madam.
Yeah, I will just take 10 minutes to brief about the schemes of IMA, in particular Karnataka Social Security Scheme, Karnataka Professional Protection Scheme, and Karnataka State Health Scheme. As we all know, we are all office bearers, seniors, IMA members, and I think very few of others are there in as audience. So, as committed seniors in IMA, my sincere request is whoever who you bump into, whichever office bearer you meet in your branch, in your neighboring branches, kindly see to it that they know more about the scheme. What I find is the practical difficulties. We ourselves as office bearers, we are not aware of about the how to put it forth to the our members. So lots and lots of doubts are there. So whenever I speak about the schemes, I see that the office bearers have more doubts and they are more interested than the other members. So now coming to the three schemes. John, next slide. Yeah, First one is the Karnataka Social Security Scheme. So it is, we are going to secure our family members, our dependents. Next slide. It was started in 1989, established in 1991-92. That is the old scheme. The Silver Jubilee year is 2015. Next slide. We have two schemes here, the old existing scheme and the new Silver Jubilee scheme. So what is it about the schemes that we are speaking? In the old existing scheme, we are just about 2,000 plus members. In the new Silver Jubilee scheme, also we are about nearly 3,000 members. And whenever we lose any of our members, we contribute 1,000 each in the old scheme and 2,500 rupees each in the new scheme. The latest that the Karnataka Social Security Scheme has given to the nominee of the doctor whom we lost is, in the old scheme it is 20 lakhs, 20 plus lakhs, and in the new scheme it is 70 lakhs. So the latest, the highest death benefit that has been given recently, the end of December, is 91 lakhs. So can you imagine any of our insurance company giving us this? And the insurance company, we pay for the office space, we pay for the manager, for the office clerks, everybody. But here in this scheme, we doctors ourselves are doing it honorarily. We are all office bearers, and we just hire one or two persons to help us with the other technical work and maintenance of the office room, etc. So the benefit that the recent benefit has been 20 plus 70 coming to 91 lakhs. John, next slide. So the head office for KSSS is at Hubli, and this is the address and the email ID. Email ID is very user friendly. We can't just miss. So better be safe than sorry is what we suggest to all our members. So just blindly listen to your co-members and become part of the scheme. And in due course, you will know the benefits, because it's very difficult for us to convince each and every member. So we'll have to give them examples and do it. The example that we are going to give is, I am the office bearer, I am the executive committee member in my branch, so I take up the scheme. Then I will be able to propagate it to other members. Next slide. So the next one is the Karnataka Professional Protection Scheme, KPPS. John, next slide. Yeah, most of us doctors would say that we are not expected to be sued, but when it happens, it comes as a shock to us, and it can hurt our confidence, because we wonder whether we could have done something differently. It's important to accept the fact that no matter however good you are and how hard you have tried, you can expect bad outcomes. So we should also understand that bad outcomes does not necessarily mean that you gave bad care to your patient. So the best option for us is, bad outcomes are the bread and butter of malpractice and wrongful death litigation. So if there is a bad outcome, you may be sued whether or not you did anything wrong. So what is the remedy for this? This is to become part of the scheme, Karnataka Professional Protection Scheme. The primary goal of every doctor in practice today is to avoid a lawsuit for medical practice. And most doctors call this as a crisis. If at all somebody is sued, you think that it is a crisis, that you want to quit practice, and that you want to retire early. And this will certainly disturb us mentally. So it is better we take a decision to be part of this professional protection scheme run by Karnataka, our own office bearers. So we have professional indemnity in Karnataka state branch. It is called KPPS, and it is an insurance plan to financially safeguard medical practitioners against legal costs and claims for compensation by the patients in case of a legal row. Next slide. Yes, and the premium that we are going to pay in the first year is going to be 3,700, and mandatory minimum annual subscription every year subsequently will be 500. Along with that 500 rupees, if in case any of us are doctors in the group who have enrolled for KPPS, if in case they go in for a litigation, whatever expenditure is there, that is equally distributed amongst all of us. So don't you think when one of our doctors is in trouble, we need to also contribute not only mentally but also financially, and this financial expenditure that you and me will have will be just very meager, just a few thousands, and every year the premium will not run to very high level because all of us are distributing the cost if at all any of our doctors go in for a litigation. Next slide. So what is the criteria to become KPPS member? You need to be a life member of IMA and you should have registered in the Karnataka Medical Council, including your PG degree or diploma. So this is one word of caution. We would have registered in the Karnataka Medical Council when we finish our graduation. But once you finish your post-graduation or super specialization or diploma, it is necessary for us to submit the certificate and get that degree also entered in our registration council certificate. If in case you and me forget to add the postgraduate degree, you still be considered to be only a MBBS graduate. And if in case, touch wood, if there is litigation, you will be treated as a MBBS doctor, not as a qualified postgraduate. So it's necessary for us to include our postgraduate degree as and when we complete. And membership gets effective from the date of realization of check or DD or the electronic transfer of the money at the bank. So next slide. So IMA KPPS prepares you for unseen risk, keeps your practice running, keeps your assets safe, pays your legal costs, and it boosts your confidence, which is most important for all of us. So join IMA KPPS and secure your profession. Yeah, the last scheme is the Karnataka State Health Scheme. This is KSHS protects you from death, disease, and disability. Join this health scheme. Your health is our concern. No health checkup is done here. The only criteria for you to join is you need to be a life member, and all our dependents also are eligible to become members. All of us pay our premium independently. So the coverage here is for 2 lakhs. So each member at home can enroll in this, and each one up to age of 85 years, even if the doctor member expires, the dependent members who have already joined, they are eligible for the scheme till they complete 85 years of age. So you need to be life member. Previous slide, John. Spouse, children, and parents are eligible provided you are below 85 years of age. No questions asked, no health checkup is done, irrespective of our health status. If you are a IMA member and if you are less than 85, which obviously all of us are, you are eligible to become the member, and our dependents also, our in-laws, our parents, our children, all of them can join the scheme. Next slide. Yeah, so no medical tests are required, and all the existing diseases are covered. Yearly premium is low compared to any other insurance company. The claims can be obtained from other policies, and benefits are covered by only for allopathic treatment. So the claims can be obtained from other policies. In case you have another private health insurance, over and above the insurance claimed from that policy, you can submit the duplicates and get the money here also. So for health schemes, the healthcare services provided is for ICU care, physiotherapy, pathology lab reports, or for all these are covered with the Karnataka State Health Scheme. That means only allopathy treatment. So a gift by parents to children and children to parents. Next slide, John. So the websites for each of our schemes, they are updated. Digitalization has happened, and you can go online and enroll yourself. And these are the websites for all the 3 schemes.
Thank you very much, Madam. Dr.
Thank you.
Anuradha Parmesh.
Thank you, Mahesh.
Wonderful presentation. Thank you very much, Madam. I thank everyone for attending this webinar, and I thank the speakers, Dr. Lalita HS and Dr. Anuradha Parmesh, for giving the wonderful presentation of both the topics. And I once again thank everyone. Thank you very much.
Thank you so much.
Thank you, sir.
Good. Both topics are very good.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you. Thank you, sir.
Madam's topic is too good, Mahesh. You chose very well. Pre-probiotic is the requirement of the day.
Yes, madam.
I
Thank you
take
very much.
pre-probiotic every day from the best, one of the best companies.